Welcome to your personal deep dive. Today we're going to explore something that, well, I'll be honest, kind of makes me squirm a little. Multiple abscesses. But don't worry, we're going to make it fascinating, not frightening. You sent us some really interesting sources, research articles, even some stuff about traditional remedies.
Absolutely.
Ready to dig in.
I am. Understanding abscesses, it's really a journey into how our bodies, defend and heal themselves.
Yeah.
We'll cover the basics, of course, but then we'll also get into some more, intriguing alternative angles. You specifically asked about honey and fasting.
Yeah, I'm definitely curious about that. But before we go there, let's start with, the fundamentals. What exactly is an abscess, and why are multiple ones, more concerning?
Okay, so imagine your body's immune system as a skilled army, right?
Okay.
When bacteria invade, they build a fortress, like a walled-off pocket of pus to contain the enemy.
Yeah.
That's an abscess. Now, when you have multiple abscesses, well, that suggests the infection might be spreading, like having multiple enemy outposts.
Yeah.
It could indicate a systemic infection, meaning it's in the bloodstream, which requires a much more aggressive defense strategy.
Okay, so more than just an annoying zit then. Got it. And what causes this bacterial invasion in the first place?
Well, often it's the usual suspects, like Staphylococcus aureus or Streptococcus bacteria. They're kind of lurking everywhere, just waiting. And if they find a weak spot, a cut, a hair follicle, even a compromised gut lining, they seize the opportunity, like a breach in your body's defenses.
So are some people just more vulnerable to these breaches than others?
Absolutely. Think of it like this. A healthy immune system is like a well-trained army, right? Ready to repel any invaders. But if your defenses are weakened, say by diabetes, HIV, or even medications that suppress your immunity, it's like fighting with a depleted force. Those everyday bacteria become a much bigger threat.
That makes sense. So it's like this combination of opportunity for the bacteria and then a weakened system.
Exactly. And sometimes an infection that starts somewhere else, like sepsis, can travel through the body, seeding abscesses in multiple locations. It's like the enemy setting up outposts throughout the land. That's when things get really serious.
So where do these abscesses tend to pop up? Is it just like skin stuff? Or can it happen anywhere?
They can form almost anywhere, but some locations are more common. So on the skin, they might appear as boils, carbuncles, infected hair follicles, things like that. Those are usually easier to spot and treat.
Okay.
But internally, they can form in organs like the liver, lungs, kidneys, even the brain. That's when it's crucial to catch them early.
Yeah. Okay, so internal ones are a much bigger deal for sure. But let's say you're not a doctor. How would you even know something was brewing beneath the surface?
That's a great question. And it really highlights why being in tune with your body is so important. The classic signs of an abscess, regardless of location, are pain, swelling, redness, warmth at the site.
So basically the area is throwing a party and you are invited.
Exactly. And if the infection is spreading, you might also experience, fever, chills, just that general feeling of being unwell. Now, with internal abscesses, the symptoms can be a bit harder to pinpoint. That's why it's so important to pay attention to any unusual aches, pains, or just that nagging feeling that something's not quite right. Don't ignore your body's whispers. They might be trying to tell you something important.
Okay, so don't be a hero. If your body's sending out those distress signals, get them checked out. But how do doctors actually diagnose multiple abscesses? Is it more than just, feeling around for a bump?
It's a bit of a detective process. Doctors will start with a physical exam, looking and feeling for those, telltale signs we talked about. But to get a clearer picture, especially for internal abscesses, they'll often use imaging techniques.
So things like ultrasounds or CT scans?
Exactly. These allow them to see what's happening beneath the surface. They might also order blood tests to check for markers of infection, and they might take a sample of the pus to identify the specific bacteria causing the trouble.
Makes sense. You need to know your enemy to fight it effectively.
Precisely. And knowing the culprit allows them to choose the most effective treatment. Speaking of treatment, why don't we talk about how doctors tackle multiple abscesses, and then we can delve into those intriguing alternative approaches you mentioned earlier.
Sounds good. Let's get into the conventional treatment strategies first. What's the go-to approach?
Usually the first line of defense is drainage. For those superficial abscesses on the skin, this might involve a simple incision and drainage procedure. Basically, the doctor makes a small cut to release the pus.
Makes sense. Get the gunk out. But what about those deeper internal ones?
For deeper abscesses, they might use imaging guidance to drain them more precisely. It's like a guided missile targeting the enemy's bunker.
Okay, so drainage is key, but what about actually killing those pesky bacteria.
That's where antibiotics come in, especially when dealing with multiple abscesses. Doctors often start with broad-spectrum antibiotics, which are kind of like a wide net, targeting a broad range of bacteria, while they're waiting for those culture results to pinpoint the specific culprit. Once they know the enemy, they can switch to a more targeted antibiotic, like a precision strike.
So it's a two-pronged attack. Drainage to remove the infection, and antibiotics to knock out the bacteria. But are there situations where one antibiotic might be preferred over another?
Absolutely. The choice of antibiotic depends on several factors. The type of bacteria, the severity of the infection, even the patient's medical history. For example, some antibiotics are better at penetrating certain tissues, while others have fewer side effects. It's like choosing the right weapon for the specific battle.
So it's not a one-size-fits-all approach. It's about personalized treatment.
Exactly. And on that note, it's important to remember that if there's an underlying condition contributing to the abscesses, like diabetes, that needs to be managed as well. It's like reinforcing your defenses to prevent future attacks.
So it's a holistic approach, treating the whole, not just the abscesses themselves.
Precisely. And in some cases, surgery might be necessary, especially if the abscesses are very large, don't respond to other treatments, or are located near vital organs. It's like calling in the heavy artillery when the situation demands it.
Okay, so we've covered the conventional medical approaches: drainage, antibiotics, sometimes surgery, and addressing any underlying conditions. Now, let's dive into that territory that piqued my, and I'm guessing, our listeners' curiosity: fasting and honey.
Yeah, these might seem a bit, unconventional, but there's actually growing scientific interest in their potential to support healing.
Okay.
Remember, though, these are complementary approaches, not replacements for conventional medicine. If you have an abscess, seeing a doctor is non-negotiable.
Right. Always follow your doctor's recommendations first and foremost. But it's fascinating that these, ancient practices are now being studied alongside modern medicine. So let's break it down.
Yeah.
Fasting first, what's the science behind it potentially helping with abscesses?
Okay, so fasting has been practiced for centuries for various health reasons, and emerging research suggests it can influence the immune system and inflammation. Think of it like this. When you're fasting, your body isn't busy digesting food.
Okay.
It can focus its energy on other tasks, like cleaning up cellular debris, repairing damaged tissues, that sort of thing.
So it's like giving your internal systems a chance to catch up on their to-do list.
Exactly. And some studies have shown that fasting can reduce levels of certain inflammatory molecules. They're called cytokines, and they're involved in the body's response to infection. It's like turning down the volume on the inflammatory signals.
Interesting. And for someone with diabetes, which we know increases the risk of abscesses, could fasting be helpful in, managing blood sugar?
Yeah, that's one of the promising areas of research. Fasting, particularly intermittent fasting, has shown potential in improving blood sugar regulation. It's like giving your pancreas, which produces insulin, a break, and allowing your body to become more sensitive to insulin's effects.
So it's not just about, starving the bacteria. It's about giving your body a chance to, recalibrate and become more efficient at what it does naturally.
Right.
But I imagine there are some downsides to fasting, especially when you're already dealing with an infection.
You're right. Fasting isn't a magic bullet, and it's not suitable for everyone. Prolonged fasting, especially during an active infection, can weaken your immune system and delay healing. It's like trying to fight a battle without adequate supplies.
So it's a balancing act, and definitely something to discuss carefully with your doctor.
Absolutely. They can help you determine if fasting is appropriate for your situation and guide you on the safest and most effective approach. Now let's move on to honey, which you were particularly curious about.
Yes. I was really intrigued by the research you sent me, especially about Manuka honey. What makes it so special?
Well, honey, especially medical-grade honey like Manuka honey, have been used for wound healing for centuries, and there's a growing body of scientific evidence supporting its efficacy. The key lies in its unique composition. Manuka honey contains high levels of hydrogen peroxide and a compound called methylglyoxal, which have potent antimicrobial properties.
So it's like nature's antibiotic.
Well, it's not a direct replacement for antibiotics, but it does have remarkable antibacterial properties. These compounds can effectively kill a wide range of bacteria, including that troublesome Staphylococcus aureus we talked about earlier.
So it's a powerful ally in the fight against infection.
Precisely. But honey's benefits go beyond just killing bacteria. It's also a fantastic wound healer. It promotes tissue regeneration, reduces scarring, and keeps wounds moist, creating an environment that's hostile to bacteria and conducive to healing. Plus, honey has anti-inflammatory properties that can help reduce redness, swelling, and pain around the abscess.
And I read that honey can even disrupt biofilms. Those like protective layers that bacteria form to shield themselves from antibiotics. It's like breaking down their defenses.
That's right. Biofilms are a major challenge in treating infections, but honey has shown the ability to disrupt these biofilms, making the bacteria more vulnerable to treatment.
Wow. So it's a multi-pronged attack, antibacterial, wound healing, and even biofilm disrupting. But how is honey actually used for abscesses? Is it just like slathering it on like a topical ointment?
There are a couple of ways to utilize honey's healing power. Topically, sterile medical-grade honey can be applied directly to a cleaned and drained abscess. This can help speed up healing and prevent reinfection. Orally consuming honey, while not directly treating the abscess itself, can boost your overall immunity and provide some additional support to your body's natural defenses.
Interesting. So you could incorporate it into your diet as a general immune booster, but are there any downsides to using honey or any types to avoid?
Like with anything, moderation and proper usage are key. You definitely want to avoid raw honey, especially if you're immunocompromised, as it can contain Clostridium botulinum spores, which can cause botulism.
Okay, so stick to the medical grade stuff. And I imagine it's important to emphasize again that honey is not a replacement for conventional medical treatment.
Absolutely. It's a complementary approach, and it's crucial to work with your doctor to determine if and how honey might fit into your overall treatment plan. Now, shifting gears a bit, let's talk about when an abscess situation becomes an emergency. When should someone absolutely not try to wait it out and seek immediate medical attention?
Yes, let's talk about those red flags. What are the signs that an abscess is becoming like a serious threat and needs urgent care?
If you notice the abscess rapidly spreading, that's a major warning sign. It means the infection is gaining ground and you need medical attention right away.
So if it's like growing quickly or new ones are popping up, that's a clear signal to seek help.
Absolutely. Another red flag is persistent fever. If you have an abscess and your fever isn't responding to over-the-counter medications or is worsening, it's time to call the doctor. Fever is often a sign that your body is struggling to contain the infection, and you don't want to let it get out of hand.
Okay, so don't try to tough it out. Fever's your body saying, I need backup.
Exactly. And if you experience severe pain or systemic symptoms like confusion, dizziness, shortness of breath, that's another red flag. These can be signs that the infection is spreading beyond the initial abscess site and potentially affecting other organs.
That sounds really concerning, like the infection is breaking out of containment and causing havoc elsewhere.
That's a good way to visualize it. And in the worst-case scenario, this can lead to sepsis, which is a life-threatening condition.
I've heard of sepsis, but I'm not entirely clear on what it is. Can you explain it in a way that's easy to understand?
Imagine your immune system as a powerful army designed to protect you. Sepsis is when that army, in its fight against infection, inadvertently causes widespread damage throughout the body. It's like a wildfire that starts small, but quickly spreads out of control, affecting multiple organs.
So sepsis is essentially an overreaction of the immune system.
That's a good way to think about it. It's a medical emergency, and it's crucial to recognize the signs early on. In addition to what we've already mentioned, other signs of sepsis include a rapid heart rate, low blood pressure, and clammy or discolored skin.
So if you notice any of these symptoms, especially in combination with an abscess, it's time to seek immediate medical attention.
Absolutely. Time is of the essence when it comes to sepsis. Early intervention can significantly improve outcomes and even save lives.
Okay, that's some really important information. So we've covered a lot of ground here, from the causes and symptoms of multiple abscesses to the conventional and complementary treatment approaches. And we've also stressed the importance of recognizing those red flags and seeking medical attention when needed.
Exactly. And it all boils down to informed decision-making. We've explored the science, we've delved into traditional remedies, but ultimately, responsible health management comes down to knowing when to try home remedies, when to consult a doctor, and when to head straight to the emergency room.
Right. And that's what we're all about here on The Deep Dive, empowering our listeners with the knowledge they need to navigate the complexities of health and wellness.
You got it. And speaking of empowerment, any final words of wisdom on how to keep those pesky abscesses at bay in the first place?
Yeah.
What are some proactive steps our listeners can take to reduce their risk?
Well, prevention is always the best medicine. Where should our listeners start when it comes to abscesses?
It really is, yeah.
Yeah.
Good hygiene. Good hygiene is like building a strong wall around your castle,
Okay.
Wash your hands frequently with soap and water, especially after using the bathroom, before eating, after being in public places.
Right.
And and treat any cuts or scrapes, no matter how small, with respect. Clean them thoroughly and keep them covered until they're healed.
So basic hygiene is like a powerful weapon against infection. What about those underlying health conditions we talked about?
Yeah, managing those is crucial. If you have diabetes, for example, keeping your blood sugar under control is key. It's like strengthening your army from within. High blood sugar weakens your immune system, making you more susceptible to infections. So work closely with your doctor to develop a management plan that keeps your defenses strong.
So it's a reminder that, our overall health plays a huge role in preventing these kinds of infections.
Yeah, absolutely. And remember those fascinating traditional remedies we discussed, fasting and honey.
Yeah, yeah.
Those can be valuable allies in supporting your overall health and well-being.
Right. They're not replacements for conventional medicine, but they can be like powerful complements to a holistic approach to health. It's like having extra troops on your side.
Exactly. And this brings us back to the heart of this deep dive. Knowledge is power. The more we understand about our bodies, the better equipped we are to make informed decisions.
That's such a crucial takeaway. You sent in those sources on honey and fasting, and look what we uncovered. A whole world of natural approaches to healing. It's amazing what happens when you start asking questions.
It is. And remember, this is just the beginning of your journey. There's always more to learn and explore when it comes to health and wellness.
Well said. We've covered a lot of ground in this deep dive into multiple abscesses, the science, the symptoms, the treatments, the red flags, even those intriguing alternative angles. We hope you're walking away feeling not just informed, but empowered.
It's been a pleasure joining you on this exploration.
And to our listener, remember that your health is a journey, not a destination. There will be bumps along the way, but by arming yourself with knowledge and seeking guidance from qualified healthcare professionals, you can navigate those challenges and take charge of your well-being. Thanks for joining us on the Deep Dive.
Until next time, stay curious and stay healthy.